Dear church family, it was so good to see those of you who managed to attend last Sabbath indoor service.
COVID-19 cases continue to remain between 50 and 60,000 cases per day, with the most recent 7-day average at 53,200 cases per day. The most recent 7-day average of hospital admissions is slightly below 4,700 admissions per day, similar to the 7-day average we had on Monday. Deaths continue to decline, with the current 7-day average of 1,025 deaths per day.
One thing that is on the mind of many people is this issue of variants.
New COVID hotspots starting to spike as pandemic restrictions relax. 15 states reporting a rapid increase in new cases in the past week.
So now we're in a race. It's a race to see if we can vaccinate ahead of the B117 variant before it sweeps through the country.
The way we can counter 117, which is a growing threat in our country, is to do two things: to get as many people vaccinated as quickly and as expeditiously as possible with a vaccine that we know works against this variant, and finally, to implement the public health measures that we talk about all the time: masking, physical distancing, and avoiding congregate settings.
Your friends, family, colleagues, classmates, and anyone else you come into contact with, even strangers, could be put in danger if you turn down the vaccine. It's not just a decision that affects you. It's okay to have questions about the COVID vaccine. That's normal. It's good to talk about them, though, with your doctor or community leaders or even friends and family you trust who have received the vaccine already.
Vaccines have been tested rigorously and they've been found to be safe and to prevent people from developing symptoms and getting seriously ill with COVID-19.
You're vaccinated and your friends and colleagues are vaccinated, that will substantially reduce the risk for everybody.
That makes sense. If you're not coughing or sneezing, then it's harder to pass the virus on. If we spread less COVID-19, fewer people get sick and the pandemic will be over sooner. So the current thinking is, if you choose to get the vaccine, you're choosing to look after yourself and everyone you come into contact with. If you don't, then you and those people won't have that protection. If too many people don't get their shot, then that makes it easier for the virus to find a way to spread, meaning more people will get ill and die.
For this reason, it is important for us to get the vaccination or to encourage other people.
Right now, the COVID-19 vaccines are available to millions of Americans, and soon they will be available to everyone.
This vaccine means hope. It will protect you and those you love from this dangerous and deadly disease.
I want to go back to work and I want to be able to move around.
To visit with Michelle's mom, to hug her and see her on her birthday.
You know what I'm really looking forward to is going to opening day in Texas Ranger Stadium with a full stadium.
We've lost enough people and we've suffered enough damage.
In order to get rid of this pandemic, it's important for our fellow citizens to get vaccinated.
I'm getting vaccinated because we want this pandemic to end as soon as possible.
So we urge you to get vaccinated when it's available to you.
So roll up your sleeve and do your part.
This is our shot. Now it's up to you.
And I hope to see you in church today or someday soon. Take care of yourself and of each other.